Flex. Extension is the other way, where you have your leg straight, correct? Yep. Wake up, guys. Come on, you're killing me. I need to work on this caffeine or coffee. Okay, so clean the skin, spray it, make sure there's no wounds. If there are, cover it. Step forward with this leg. Again, for purposes of demonstration, we're going to put a pre-wrap on. Generally, we would not. Another thing, what are we going to want to do with this since she's bent? Yeah, just put one. Unless they're pretty big, you can put two. It's up to you.
What was that?
A heel lace pad right here. So just like the valgus and varus ones that we did, you're going to go about halfway, thigh and calf. You're going to do anchor strips. Now, if you have a habit of just going straight, you want to do this basket weave. And what that means is you want to angle them a little bit up, okay? Because if you try and go straight, I'll show you. I'm trying to go straight around here, which actually it works on her. But if you notice, like when I pull, she's got bulging going on, especially on the medial side. So make sure you're doing that basket weave and angling those, okay? Because that'll be uncomfortable for them. And then we could have a blister issue or a hot spot, maybe not quite blistered. Same thing up on the thigh. So just like the valgus and varus, you can do this with elasticon. You'll probably see this more with elasticon than you will white tape. But for the purposes of our supplies, we're going to do the fanning technique again. You can do that fanning technique that we did on the Achilles and turf toe for any joint, almost. So elbow, knee, Achilles, turf toe, finger, if you want to go that small. So do your measurement strip. And you're going to want to let it relax a little bit, because if she really can't straighten her knee, that might be a little uncomfortable. So I'm going to do it on the table again. You can do it, like if you want to, and you can work it so you can do it right on the leg, just in separate pieces, that's fine. It's up to you. Personally, I like to do it on the table because then when I apply it, I can anchor it and then pull it so there's enough tension to stop it from hyperextending. I'm actually going to make two of these because with the knee you're going to have a little bit more force than we do at the ankle. Why is that? Why would we have more force acting on the knee than we would on the ankle?
Muscle activation.
The muscles involved. There's a lot more muscle. Okay. So you got that. Now, is it going to matter which way I start? Is it?
Yes.
How do we do the Achilles? We start on the foot, right? Which is what part? Is this the mobile part or the immobile part? It's a lever, right? So it's moving. So if she's going to hyperextend, what's most likely going to cause it to hyperextend? Your tibia and your fibula, right? So I'm going to start down here and I'm going to pull up, okay? Because that tension is going to be greater than pulling it down, which means it has a better likelihood of preventing that hyperextension. Okay? Does that make sense? Do you want me to shut up and not give you the educational component?
No.
So just kind of lay it down. Don't pull it yet because it'll just come off. Just anchor it once. Twice if you're not feeling good about it. And for her, I'm not going to pull too hard. She's already in a bent position. If she was in a straight position, I would probably pull a lot harder. But since she's already bent, I'm just going to pull it so that it's tight. And if you're uncomfortable with how much she's bent, you can always have her straighten more. Okay? So then do another anchor. So I'm going to go ahead and just anchor her to close it off on the bottom. And just pull so that it's tight. So should I stop there or keep covering?
Keep it covering.
Why?
Because of the top.
Cover the fisters.
What's that going to do?
It's going to hold it.
And what's that going to do to my tape job?
Really.
Yeah. Did you ever hear that? I mean, if you're practicing and you got some loose ends and you know it and you understand that you need to cover it in the test, that's fine. So try and straighten that, ma'am. Yeah. Again, it's not terribly comfortable, and I probably could have had her straighten a little bit more for functionality purposes, but there you have it. That X you want, this is called your popliteal fossa, where you have that crease in the back of your knee. That's where you want your heel and lace pad, first off. And second off, that's where you want that X to be. Okay?